I think, thank you. It's always a pleasure to come to AFMC. And this hall is very nostalgic because I've given so many talks here. I would like to thank many people, also the Colonel Day. Now, I always believe I'm an Apple fan and I always feel Steve Jobs, market research and iPhone. Our task is to read things that are not yet on the page. And anybody who has seen 2007 when iPhone was introduced, I think it goes that what was a phone for communication has become a computer in our hand. So it completely changed the way we looked at mobile. So artificial intelligence has already entered our life. I mean, all of us talked about all this. People talked about movies, people talked about Digiyatra, people talked about space, everything. We every day deal with artificial intelligence today. If you look at PubMed, there are about 263,000 more than that publications in last 8 years. Just imagine how many publications. Why people are so much talking about this. And everybody talked about AI and ML, the three concepts which have come over last 50 years. Now, when you talk about AI in simulation, it involves using AI techniques to create realistic, I'm not saying realistic, it is real, close to realistic, data-driven simulations which mimic real world. Now, basically AI has basically four purposes. Enhance learning, you learn decision making, that's all knows how. Predictive modeling across fields like medicine, engineering, aviation, and military training. So when you look at AI in simulation, there are various kinds of simulations. One is predictive simulation. Second is interactive simulation. Third is a behavioral simulation. And fourth is an immersive simulation. Now, when you say predictive simulation, use AI to forecast possible outcomes. This is something which is very important, like weather forecasting. Financial modeling, AI weather forecasting has become very common today. In fact, AI for science, predicting infectious disease. Today we are talking about infectious diseases, how they are. This is paper from 2024, predicting monsoon outbreaks. Now we get in Mumbai a lot of monsoons. So in fact, when I was a dean 2016, we started the first AI model to look at the dengue outbreaks based on the type of pattern of the monsoon. So what we did last took 50 years of the monsoon data and we put it into AI and we did data analysis and we found out how the dengue outbreaks are going to be based on the monsoon patterns. Very interesting. One of the person did PhD on this. It's a big data analysis. It's a published paper. Artificial intelligence is used for predicting preterm births, estimated fetal weight, predicting successful vaginal delivery. Artificial intelligence in predicting post-operative surgical complications. This is all predictive simulation. You create a situation and then you work on this. The second is interactive simulation, which I think Karuna showed quite a bit, I think. Allows real-time interaction between users and simulated environments. It's a virtual training for pilots, surgeons, especially if you see the Sully movie was a very classical movie about the interactive simulation, like say AI Harvey, cardiopulmonary resuscitation simulator. This is all, it's kind of interactive simulation. Autonomous robots today have come and they are talking about surgical precision using AI. In fact, AI simulator for training brain surgeons, these are all now available. And look at this AI simulation in obstetrics. This is using, somebody is using HoloLens 2. But I must tell you, HoloLens 2 is now out. There's much more is coming ahead. But look at this. You can put on sound. I'm sure there'll be a lot of things which will be there. And you will find the way people now do deliveries.
CME Healthcare selected shoulder dystocia as the first scenario on Lucina AR because it's a rare complication of delivery, but it's one that's difficult to manage. You have a number of options. You need to think fast. Seeing the anatomy, seeing the progression of the baby in the birthing canal, and seeing where the shoulder gets stuck is going to be very helpful to understand how to fix it. Seeing them in front of your very eyes as a student is like a revelation, right? This is the future of healthcare education.
And see, here you are seeing the students are doing it. They have problems, put it into this, and they are explained about this. Now you will find, look at this behavioral simulation. This is the new world of AI simulation, where if you look at this artificial intelligence in behavioral and mental health care. Now, this was considered to be an area where there is not much of artificial intelligence, but today it has come. In fact, if you look at this, how they have trying to focus on simulating the human and animal behavior. And they now called Lancet, published this paper of digital mind, AI-informed mental care, promised to practice toward the realization of AI-informed mental health care. And in fact, they developed this whole model of how you can AI augment the mental care pathways. There's Amruta Vishwa Vidyapit, who have now 95 more than virtual simulation. This is from India again. AI is now extensively used for communication skills. Now there are she showed Sarah. Now there are so many Indian versions have come, which are now trying to teach you, and they're the health communicators. So we have gone much ahead than what we really think about this. The third type of simulation in AI is what is called as an immersive simulation. I think Karuna showed some of the examples, military drills. And now look at this doorway to future. Now look at this kind of an immersive lab. This is in India. This is from GSL, Rajmandri, in one of the corners of the Andhra Pradesh. You have now a student can see, he can touch, he can rotate everything. I mean, you look at this kind of a training he is going to do, then I'm sure he will have a better understanding. I'm not saying he will have completely haptics. The haptics is coming. Look at this advanced robotic with AI-driven technology. Now, clinical application of artificial intelligence in robotic surgery. They will show you where is your dissection plane. The AI will guide you during the surgery. Now, if I do this same patient CT, I put it into a particular kind of a focus, it will help me to know which dissection plane I'm going to operate. And next day when I'm operating, it will tell me how I can operate in that particular plane. It will guide me through that particular thing. Now, these are something which I call are advances which have come for the help of the clinician, which will help me to do better patient care. And now these are not very difficult to do, I mean, I can avoid injuries to various nerves, vessels, which is very, now the new thing like colubrics, where now endorobotics have come. Endorobotics now help you to do with two links, and they can really operate. They can operate anything. You can suture, you can do a rolling stitching. I mean, all these now can be manipulated with the help of AI with minimal amount of thing. Then when you look at the methods of AI simulation, there's a data-driven simulation, agent-driven simulation, hybrid simulation, and digital twin simulation. These are the new technologies that I'm going to talk. Now, data-driven is very simple. AI processes historical data to generate accurate simulation. Traditional, your diagnosis of appendicitis versus true appendicitis versus the AI-based appendicitis. And it shows 94% accuracy. This is from Surgery 2020, very reputed journals. Then AI Madurai-based, hospital like the Google AI and Arvind Eye Care, they started working towards this precision health. Agent-based simulation, individual agents with AI-driven behavior to simulate complex systems such as crowd movement of the disease. Now, most of our hospitals are like this, crowded casualties. Clinical flow management is very poor in our hospitals. KEM, we have 10,000 OPD, 800 emergency patients, 200 patients are waiting in the emergency in casualty, 150 require kind of ventilators. Imagine this kind of a situation. Clinical softwares are something which will help me to find out how I can take it through this. This is called an AI-assisted acute patient journey mapping and a concise review of AI-based solutions for mass casualty management. Now, they were talking about 6 patients, which patient is, I mean, these are all things which probably will come to over a period of time. Then the third thing is a hybrid simulation, where AI combines with the traditional simulation techniques. And this is where augmented reality is taken. What we call about mixed reality is a hybrid simulation, where you would like to have real world to virtual environment, and you will have an extended reality to mixed reality, and from low immersion to high immersion. And when you start using mixed reality, you start working on, say, myometry. So for example, myomectomy. I can give you thousands of examples of this. But if they will create a situation like this, where you exactly know where to operate. And this is done before. The another technology which is coming up is called as a digital twin technology. Simulation. Now this is called as a DNA nudge technology. Creates a digital replica of a physical asset. For example, if you see this in a diabetes patient, you have a physical entity, you have a digital twin, and you create a digital nudge out of you. And you start treating a patient's diabetes through which, something like this was presented in AI and AMS conference March 24 in Mumbai. And this was an experiment done in Mumbai for last 5 years. And they created complete digital twin to treat a patient's diabetes. AI tutoring and assessment has come in a big way now. Somebody was talking about how do you use it in assessment. Now, AI tutoring with remote expert has been the part of the whole surgery. For example, if you use with the AI tutoring, people achieve much more than just doing it. And how do they do it basically? For example, if I have a resident who wants to learn laparoscopic surgery, what I do, I take his videos and I put them into the AI data analysis. Now I do this and it will give me all this anatomy detection, instrument detection, and it will tell me exactly, for example, if you do his insert, he'll tell me how many times he used bipolar, scissors, in which direction, what was the direction, what was the wrong in his direction, how can he now improve by doing exercises in simulation. And at the end, I can find out whether he has done it well by doing those exercises. Now, I don't need to be here. I only need to give him instructions. So that means this AI-based tutoring has made my job much easier, more objective, more scientific. And this is what exactly they are all talking about. Now let's come to the main topic today, that is virtual patients. Now we are all talking about virtual patients. All this grew up during COVID. Now when COVID came, people realized that we need to have virtual patients. And then there was an era of research which came into picture. So virtual patients came. So what are virtual patients? Virtual patients are computer-based simulation designed to represent real-world clinical scenarios. And as Karuna said rightly, most of them are at a knows-how level. Very few have gone to shows-how level. Most of them are cognitive still. We still have, though there are simulation labs which are real simulation kind of mannequins where we learn shows how, most of the time when we talk about AI, because it is an intelligence part of it, it still requires goes to the higher level of cognitive, that means knows how. And these virtual models allow medical learners to interact with digital representation of patients to practice diagnostic, clinical reasoning, and decision-making skills in a risk-free environment. Every word of this is very important. What are we asking them to do? We are asking them to make a diagnostic, clinical reasoning, and decision-making in a risk-free environment. Somebody said, why do I want to do it with this AI or mannequins? It's a risk-free environment. I can practice it till my learning and analytics become all right. I'm minimizing my patient's risk. If you really look at first-year residents, we find so many hypostelia problems with them. The virtual patient can be text, audio, images, or videos to simulate the symptoms, and interaction occurs through branching scenarios or AI-driven interfaces. Now, India has a long history. I don't know how many of you have seen during 1983 and that time there were PMPs, there's called the patient management problems, and there were algorithms that time. They were all done based on very paper-based. Now we are trying to convert them into the AI base. So what are the core features? Simulate real-life patient cases across diverse medical conditions and demographics. Provide instant feedback on clinical decisions and offer adaptability to cater various healthcare education needs. What I think Karuna said was very right. I remember when we started in a skill lab, we put that every medical college should have a skill lab. So what people did, they bought a skill lab, but that skill lab was locked. There was no access to the students. And even if they go, they were wandering on their own. So now over last few years, what need to be done, we need to create modules and see how those modules are to be integrated with your curriculum, in your day-to-day curriculum. You talked about IV kind of thing. Let's have a task trainer with a IV kind of in starting. You could create a module, allow it to be part of that curriculum. Now, this is what is the need of the day. This is where AI is going to help you. This is where your virtual patients are going to help you. So benefits of virtual patients, I'm sure there's enhanced accessibility, but safe learning, standardized patient experience to all learners. And that is very important. Otherwise, what happens? A person only gets experience, other doesn't get it in the batch of 250. Now, how do you make it standardized? Cost effectiveness. Compared to the live patient simulation, this is always a question mark, because in India, we always say, we have too many patients. Do we really need simulation? That was the first question people used to ask. But you must tell you today, when I was a student, 20 of us used to look at a breech patient and that lady used to allow it. Today, a lady with a breech will not allow you to do that because she's worried about her risk, and this is ethical. Probably we that time were not aware of those things, but today we need to have these simulations to learn. And facilitation of a self-paced and flexible learning. We have to really talk about flexible learning in a competency-based education. Everybody doesn't learn in the first phase. Somebody may take 3 attempts, somebody may take 5 attempts. What are the types of virtual patients? Let's go into little more details into this. First is called as a scripted virtual patients, pre-programmed decision trees. You have proper kind of patients and you're expecting them to have. So you're creating a script, you're creating what you want to design, what kind of decisions your students want to take, and then you are giving them and exposing them to them. Artificial intelligence-driven interactive patients, avatar-based virtual reality simulations. This is becoming very popular, avatar-based. I'm sure many of you have seen the Avatar movie, but now there's Avatar has become very popular today. And hybrid models combining virtual and live patients. So when you're talking about scripting for a virtual patient, you provide enough detail and context for a virtual patient, and you at least have 500 characters of patient information. You go on adding, I don't know how many of you know about prompt writing in AI. The most important part of generative AI is prompt writing. The way you write prompt, you will get out of that generate. So same thing here, the way you write proper characters, you will get an output like this. So for example, this is kind of virtual patients where you have emotionally, you are looking at it, you are looking at the questions. You could have evaluating a script-based approach for simulating doctor-patient interaction. Today, we have so many softwares where this is a patient, I'm sitting, I'm looking at it, and I go on do interviews, effective virtual patient simulators. Now, if you do this medical education article, very interesting article of systematic review, what it says, evidence-based virtual patient training can enable students to get communication skills, and elaborate technology alone but cannot guarantee effective learning. And that was always an point. You have to have some kind of an experience when they go out. How to create your own AI-powered virtual patients for free. There are so many sites today where you can design your AI-based virtual patients. You can create your stories and convert it into a patient. And then you can make it interactive. Like radiating back pain, 45-year-old woman, you put candidates instructions, patient instructions, examination instructions, single play mode, generate a virtual patient, OSCE community. You can do everything. These are now fairly easy programs where to create a patient. And once you create a patient, then you start chest pain 01. You start, hello, my name is Chris. And then she'll say, this. How can I help you today? Then something like ongoing talk. And this helps you to use your words. And then through which they open up the decision-making tree. And then at the end, they will give you feedback. You could have asked this history. You could have taken this investigation. This is the way you could have gone. So they would try to open up that window and they will give you a proper feedback. And this is something which I personally feel, I'm sure we have 1-minute preceptorship and all that we do. But now these virtual patients, which are interactive, created by AI, I think give you a much better feedback. That doesn't mean that we have to get away from the clinical wards. They have to really see the real world situation. They have to see what it actually happens in OPD. But this probably trains them better. And that is what I feel we should really do. Look at these avatar-based virtual patients. This is a new world which has really come. You have a stopping antidepressant. She suspected bowel cancer, osteoarthritis consultations. These are some interviews where they create avatars. They create some kind of an patient. So you feel little real-like. And then people talk about it, something like type 2 diabetes, remote consultations, and you go through these kind of sites and you realize the world has gone so much that a student can really learn so much about the communication, decision making, and how he is going to go through this avatar-based education. In fact, you look at this, there are 321 articles on avatar in virtual patients. I was so surprised. I thought, is it new? No, there are already people have done so much of research and they have come out with so much of literature on this. And if you see last few years, already there are more than 100 and 150 articles. Now, if you really see AI-driven rehab hybrid models, this is a Nature paper from Digital Medicine 2024. It is the latest paper. And what does it talk about? You have a clinician on one hand, artificial intelligence on one hand. So they use some kind of an hybrid model where people work together and then they would give feedback through a real clinician. So there's some real clinician element and there is some component of an artificial intelligence. So what is going to be more popular today is teacher sitting with you. Now you'll ask me, why should I learn about this as a teacher? You must remember, somebody asked this question. I think that question remained unanswered. Okay, will there be cheating increased with the AI? I must tell you, cheating is a social problem. Students are always smarter. They will always go one step ahead of the technology. So we as a teacher should know what are the new technologies so that we should be master of that technology when students are using it. And that's the reason we have to know about all this. So when somebody is using this technology, they should use this technology. Along with that, a teacher can give his own subjective feedback. And that will be probably the best combination a student will have in a different situations. So there are core features of virtual patients, realistic clinical scenarios. You can really get the best classical cases and real situations you can get. Multimedia integration, interactive decision-making pathways. You can give instant path and what is called as a performance analytics. I think this is something is the most important aspect of all this digitization and customized scenarios for various specialties. Now, technology supporting this, I'm sure VR and AR we talked about, web-based and mobile platforms are becoming very popular today. As I said, it is cheaper today. I think as I said, Indian company has already come out with the VR and they are already launching it. But I personally feel over next 2-3 years, all this will be easily available and we will be able to use these technologies, not very remote, telementoring, telesimulation. These are not going to remain words which are only on paper. They are going to be there already. Web-based and mobile platforms are used now more and more. And most important is now all these need to be integrated with your LMS. Whatever LMS you are using, I think we need to integrate this. And there are many universities, Now, to be very frank, I work for Tata Institute of Social Science. And whenever I get assignments or projects from them, they already have got plagiarism check for AI similarity. And this is becoming very common today. So LMS will check it for me. It will find out which areas are copied from AI, which areas are copying from internet, and it will give me complete thing before even I start analyzing that particular case. So there are challenges of using virtual patients. There are technological barriers. I find many people still not be able to work on these mobiles and laptops effectively. High cost and maintenance. We must really understand in our country, high cost is always there. But today, I think things have become a little cheaper. For example, making PowerPoints. You remember? Now, AI PowerPoint gives you at 83 rupees per month. And as many you want to do it. So now these are becoming cheaper, affordable to all of us. Teachers' resistance. That is the major problem we are going to face with all this. The maximum resistance comes from teachers, not from the students. Students are ready to accept. I'm sure half of the students have already started using ChatGPT and everything. The teachers are one who are afraid they're not so well versed, and they have the resistance. Ethical considerations. I think that's the major problem. As I said, that ethics, Karuna talked about it. But what we should use, should we disclose it? As a journal, I'm talking about, I'm on the editorial board of medical education. For last 2-3 years, we are all talking about in our editorial board about how do we bring ethicality in medical education journals and how people should really expose it, and replicating human and emotional behavioral responses. So if you look at the literature, impact of small group virtual patient simulator training on perceptions of individual learning process and curricular integration. This was a multi-cohort study published in BMC Education fairly recently. And what it says that perception of individual learning processes and curricular integration improved after exposure to small group BPS training. And this is accessible, low risk educational strategy. And actually they are very positive about it. So we are all in a phase of excitement, though we don't know how valid it will be there and how long term we'll use it. What will be the real lore of this into our day-to-day teaching? But we need to explore it, really find out how it is, and then adopt some part of it where we find there are difficult cases, non-accessible cases, some problems we want to face. We can definitely use this technology for them. Now, in Indian context, too many patients in OPD in a government hospital. Do we really need all this? Maybe it's your own choice. If you feel you can use part of it, not necessarily adopt everything. Role in rural healthcare education where live patient exposure is limited. There are so many medical colleges in India where there are no patients. I go there and many times I find their OPDs are empty. Adopting virtual patient scenarios to reflect India's healthcare challenges like infectious diseases, chronic conditions, and cost consideration, scalability for widespread adoption. I know we all are, many times I see in our own practice, we do Indian jugaad. Jugaad is again our word, where we now try to work on around it rather than going through it. And I'm sure we'll do this. So what is future of virtual patients? Advances in realism. We need to have now emotional and intelligence conversational AI, which are coming up. I must tell you, emotions are coming with AI. Integration with robotic and haptic technologies. I showed you how I use robot for dissection. Expansion into interdisciplinary training like nursing and physiotherapy. The team training is best taught with the crew management AI. Something like that showed. Like when you are trying to resuscitate in an ICU or in a military drill. This is where the AI has definitely a role. Use of telemedicine. I'll finish it in a minute. Okay. And scalability. So this is something which has come up in a new way. A virtual patient with your angio suits, vascular patient link, all these are in India available, and data privacy bias, which is already there. Ethical guidelines, which are very important. A lot of ethical guidelines come. My granddaughter, who is in a 6th standard, came to me and asked me that she already has a lesson on ethics in AI. Imagine this is already in their studies. So what is future now? I'm sure we are going to have. What happened? This is not working. Can somebody just, the driverless taxis. Next slide. Can we just push it? Don't bother. Yes, AI hospital in China has already come, world's first AI. And this last one, which I showed you, was the AI health communicator like Sara, which has been created by the AIG hospitals. And I think these are something which are important. So conclude, I would like to say, AI in simulation offers unprecedented accuracy. There are AI and computing power continue to advance simulations and expected to become even more realistic, predictive, and integral to high stakes of training environments. AI has come to stay. AI has potential to improve surgical outcomes. AI will not replace surgeons, but will augment their performance and embrace technology while staying human. That's the only last message I want to give you. So everything will come, but the humanity, the humanness, that is where we need to score over the AI. And that is the line, and that's where we should work on this. So thank you so much. I'm sure I'll take some questions.
Thank you so much, sir. We are humbled to have had this talk from you. In fact, having touched upon the various elements of medical education, even to the point of using AI for formative assessment, we would be able to take just one question. I'm sorry, because of paucity of time. Yes.
Sir, good afternoon, sir. Sir, it was an absolute privilege to hear you, the exhaustive details with which you went into clearing our concepts. Thank you so much, sir. The question that you raised and the question a lady raised a little earlier about the haptic feedback, I just wanted to inform you that here in the Department of Surgery, we've procured the Symbionics lab simulators. So that
there is some AI element in that.
Yes, sir. So if you try and cut the cystic duct, your hand reverberates and it gives you a jerk back. So probably we are making strides on that. We'll be more than happy to show you, sir, in case you
Sure.
want. Thank you so much, sir.
Thank you, Carlos Alpha. So please, sir.
So very well spoken, sir. As a medical educator in a private medical college where I work, do you have a solution for the paucity of patients? Do you think you can implement virtual patient as a universal panacea?
I think people have been using it all over.
They are using, but still, the paucity of patients. I worked in government medical colleges. So this paucity of patients, and we try to put the wolf's clothing on a sheep and try to say that we have patients. But this is the real problem here. We need to train people.
See, I must tell you very clearly, what we are going through is a chaos in medical education in India. We have increased the number of seats without increasing the infrastructure. The same institution has now 24 students where there were 8 students of PG. And now you are finding you don't have enough work for them. Now, this is where I feel simulation and their skill upliftment is going to be of help to them. So skill labs is definitely there. Virtual patients for OPDs where people don't get to see uncommon cases, complex cases. I think this is where you can definitely use these patients. As I said, it should be supplementary rather than completely changing.